there for what? To have you watch, right? So they gonna say something. So for example, the vaccine, Delta, the variants. We've known that variants happen with viruses forever. That's not news. But the news will make you think that this is something brand new that just dropped on the earth. All of a sudden there are variations to vaccines. So make sure when you are doing your research that you're looking at reputable sources and not Instagram and not Facebook and not the latest news headlines. We need to make sure we're educated so that we can make the decisions that are right for our health. So we do encourage you to get the vaccine if you have not had the vaccine. There are a lot of myths out there. I think I've heard everything from microchips in the vaccine to if you stand next to somebody who had the vaccine, all of a sudden now you're going to be affected by the vaccine. You know, those things, when they start, they can spread like wildfire. You know, somebody has a post, and by the end of the day, it's viral on social media. So those are indeed myths. And these vaccines are safer, and more heavily studied than a lot of vaccines that we've seen in the past. And you're not getting a dead-end, weakened vaccine like some vaccines are made to be. So we really do encourage you for the health of yourself, your family, especially if you have grandchildren that you're hoping to take care of, or people who have a lot of conditions or may have a compromised immune system, as well as your communities. Vaccination is one of the main ways we're going to stop having to wear these masks. So we really do encourage you to get vaccinated. And I know our flu rates are much lower than they have been, but you know why? It's because everybody's been doing the stuff that we've been telling y'all to do forever. Wash your hands, use hand sanitizer, socially distance, use masks. That's why it's lower. It's because we're doing all the things that we should have been doing to stay safe. So we do encourage you to get the COVID vaccine, and we encourage you to make sure that you are watching what you eat and staying active. So I'm going to open it up for Q&A.
I wanted to, maybe we take a couple of questions. Time is going, but let's take a look. This is important. Let's do a couple of questions.
Absolutely. I'm going to take her first and then over here.
My question is, for those of us who have underlying conditions that can't take the vaccine, what is the alternative?
What's the alternative for people who have conditions that cannot take the vaccine? Is that what you asked? That is going to be a conversation between you and your physician. We do want you to make sure you're speaking with your doctor about what's going on with your health and whether you should or should not get the vaccine. If you are not going to get the vaccine, you still need to do all the safety things that I've talked about. And that's being socially distant, wearing your mask, washing your hands. All of those things prevent the spread of a lot of different diseases.
And I just want to add that there are very few diseases that will stop you from getting the vaccine. There are very few of them. The majority of diseases, you actually need the vaccine more than anybody else. People are concerned, I'm pregnant, I can't get the vaccine. No, you need it more than anybody else. I have kidney disease, I can't get the vaccine. No, you need it more than anybody else. So for most diseases, you need the vaccine more than other people who are healthy. Are there some instances where you really shouldn't get a vaccine? Yes, but there are very few, and please talk to your doctor about it.
Is there anything there that is looking, because I absolutely cannot take that shot. So is there anything that something else?
There are other drugs being studied right now. For example, for flu, we have antiviral medications that we can give someone very early if they have flu. So there are some medications being tested right now that we may see come on the market to help with COVID. At Intermountain, we're giving monoclonal antibody infusions, which is for people that are pretty early in COVID and only mildly sick. Can't be really sick, can't have a low oxygen level, but the monoclonal antibody infusions have been proven to help patients not get sicker and end up in the hospital. Thank you for your question. I'm gonna go over here and then I'll be right there.
You mentioned that we should have a colonoscopy every year.
So it's typically every 10 years. Every 10 years. It's mammogram, and even if there's anything, it's all 10 years. But colonoscopy is 10 years, okay? Now, if you do the blood, if you do the stool sample, okay, that is what you have to do every year. So I tell my patient, why didn't you just do the colonoscopy? You don't have to worry about it for another 10 years. It's 10 years.
And the other great thing about colonoscopy is it is one of the only preventative screenings that you can remove polyps and actually remove the risk of cancer. So colonoscopies are very, very important.
Okay, I know we've run out of time, but one more.
Okay,
The general.
I'm sorry, what's the gentleman behind you? I'm sorry.
Yeah, my question is, the news last night was saying, if you are not so sick, you shouldn't take the booster dose. I've already got 2 shots of Moderna over 6 months. I'm due for the booster dose. Is it safe for me? I'm hypertension.
It is. The booster dose, of course, because this is a newer vaccine and the studies have shown that immunity to the COVID vaccine wanes over time, just like the flu vaccine. That's why we have to get a flu vaccine every year, because over time that immunity wanes or gets lower. And so yes, the booster has been proven to be safe, and we do encourage you all to get that booster too. It has been approved now, and it is half of the dose of the first 2 doses. So you got 2 full doses, the booster is only a half a dose to lengthen that immunity.